We're here at the Iowa City Rediness Center, which is currently the headquarters for Task Force East and the Regional Medical Coordination Center 5, supporting the southeastern portion of Iowa, 16 counties. At both the state and the regional level, the National Guard has partnered with the Iowa Department of Public Health to best serve the clinics and long-term care facilities, ensuring that they have the resources and support that they need throughout this pandemic. Here we are coupled with the Iowa Department of Public Health community coordinators that cover the group of counties that we're assigned with, and they are the direct coordinators with the long-term care facilities, and then we support them with resources that the Iowa National Guard has to offer. On a daily basis, we're reaching out to each of the medical facilities, both hospitals and long-term care facilities, to understand what their needs are and what their capabilities currently are, and that helps us, through the Iowa Department of Public Health, determine where we can best resource them and support them. Being from just outside of Iowa City here gives me a lot of pride to be able to help the citizens here around our community all throughout eastern Iowa. We have a great team working both on the Iowa Department of Public Health side and on the Iowa National Guard side. We're really here to serve the community, and being from here, from Johnson County, it's really a great thing to be able to serve our community here. A lot of the National Guard's focus in recent years has been, deploying overseas and helping with that mission to fight the war on terrorism, but this mission has a much different focus. But we're glad to be able to be used and very proud to serve the state of Iowa in its response to help saving other Iowans.
Please rest assured that the Iowa National Guard, the Department of Public Health, and the rest of the state agencies that are supporting this response, and local agencies as well, are doing everything in our power to keep you safe, to make sure that we have the available resources that you may need if you would become sick. We're preparing for the worst, hoping for the best, and we will take care of you. That is our mission, and we are working diligently to make sure that the resources are there, that you can be taken care of. The reason this works so much better than necessarily a statewide or at a county level view, it gives us a little bigger geography than a county, smaller than a state, so that we can provide very timely, relevant information to the folks that need to make decisions on the ground as far as where patients need to go, what kind of resources they need, and yet still have the ability to roll that up into a statewide view for state decision makers such as the governor. The first is they've provided us a location. We're in Iowa National Guard facilities around the state. There are 6 of them. In addition to the facilities, they're providing us with personnel to help manage all of the collection, putting the data together, putting it in a form that can be analyzed, that can be used by those decision makers, pairing that with our local, our civilian counterparts, to leverage the relationships and the expertise they have within the public health world, to come at the end of the day with a really good product that decision makers can have, make good decisions. It's vetted, it's validated, it's timely, and that's the key. I mean, that's the partnership between the Guard and public health. Without the Guard staffing, we wouldn't have the personnel to be able to do this in such a timely fashion and have a fabulous location to do this work. So it's been a great partnership. The beautiful part of this partnership, we all at the end of the day have the same mission. We're here to serve the citizens of Iowa. That's why we're all in the fields that we're in. And it's able to take something that on the surface doesn't look like a natural partnership between the National Guard and public health, to be able to show how that we can work together to provide better care, to make sure that we have the resources available to care for the citizens of Iowa, working in partnership with our local hospitals, local public health, long-term care facilities, to be able to get data, have the best information we can have for decision makers to make decisions so that we can keep the citizens of Iowa in a true healthcare setting throughout the evolution of this disease that is COVID-19. These regional medical coordination centers are kind of a new partnership between the Guard and public health. And it has come about because of a need to be able to more rapidly gather data, analyze it, and make use of it. But the need is not because any one piece of this system has failed. The hospitals have been preparing for many years. The state has been preparing for many years. But this is a unique experience that is hard to imagine when you're developing plans and processes, and I think this shows how good the Iowa National Guard, the Department of Public Health, and others are at making plans and being flexible enough to respond to any emergency, to protect the citizens of Iowa, because that's our ultimate mission.
Great.